All right, the first exercise we're going to do is called the alar stabilization exercise. And what that's going to do is going to stabilize the ligaments on the upper cervical spine or the upper neck. So Dr. Eric, go ahead and get in position there. Okay, he's going to put his arm on the back of his neck and the other arm on the back of his tricep. And what he's going to do here is he's actually going to rotate his neck, his head, into the side of the elbow. And the whole point of this is not to move the head, but to provide enough resistance so the head remains stationary. So this is called an isometric exercise. So Dr. Eric, go ahead and do that for me. Great, good. As you can see, he's contracting. He's rotating his head to the left, rotating the chin to the left, but yet his head does not move. Isometric, staying the same measurement, staying the same length. Great. This is the second exercise. This is called the Atlas stabilization exercise. And what Dr. Eric's going to do is put his left hand behind his neck again, and he's going to rotate his chin all the way into that left side and go to the rotation is at full rotation there, and he's going to hold that position there for about 3 seconds. And again, this is another isometric. So it's keeping the muscle at the same length at the end range of motion. Great. The third exercise is the lateral bending of the neck. And what Dr. Eric's going to do is he's going to put his hand up on the left side of his neck, and he's going to flex his head to the left against his left hand there against resistance for 3 to 5 seconds. So this is the lateral bending neck exercise for stabilizing the neck. Great. This is another lateral bending exercise of the neck, but on this exercise, Dr. Eric is actually going to engage his middle back muscle. So this would be good for a patient with a scoliosis or a weak middle back muscle. So what Dr. Eric's going to do is he's going to put his right hand behind his neck like that, and he's going to laterally flex into his right hand, and then he's going to be pushing into the wall. So it's working the neck muscles and also the upper middle back muscles. Again, a great exercise for scoliosis patients. Great. The next exercise is actually called the chest expander, and this is really important exercise. Anyone that has this kyphosis posture like that, which is a tremendous amount of people, what this is going to do is help retrain those muscles and get that kyphosis posture out of that spine. Okay? So Dr. Eric, go ahead and lift your hands above your head there. You're going to clasp those hands together. You're going to bring it down. Yeah, you're in full contraction right there, squeezing and pressing forward. It's a tough exercise. Bring it down to your chest. Excellent, good. So that's the chest expander. Make sure that your neck remains in extension. You don't want the neck going into flexion or forward head posture. That's exactly what we don't want, because the forward head posture will actually make the kyphosis worse. So make sure that head is in extension slightly, and make sure that chin is parallel to the ground there. Great. The next exercise is called the praying mantis exercise. It's actually one of the tougher exercises for your home care kit. So what Dr. Eric's going to do is he's going to put in the same position as the last exercise. He puts his elbows together. It's very, very important that your elbows remain together tightly. Okay? Hands very snug right there. And he's going to elevate his hands towards the ceiling, keeping the elbows together. And what that, I guess you can see Dr. Eric struggling a little bit there. That's a tough exercise. And you want to make sure, of course, as the same as the last exercise, that the chin is parallel, the head is slightly to extension. And what this is going to do is going to strengthen the posterior chain and the middle back, and it's also going to help take this forward rotation of the shoulders out and bring those shoulders back into the posterior position. So that's the praying mantis exercise. Great. The next exercise is called the arm squeeze exercise. So this is when you're going to use one of the spinal molds. Okay, you're going to use the firm one. So Dr. Eric, go ahead and put that underneath your arm. It goes snug up right against your armpit there. And then what you want to do is you want to squeeze the arm into your body for a contraction of 3 seconds. And this is going to help strengthen and stabilize, again, the middle back. Great exercise for scoliosis patients and kyphotic patients. Great. The next stretch is called the psoas stretch. So Dr. Eric, go ahead and put your right foot on that chair. And the position is very critical in this stretch. You want to make sure that the knee is coming up here. There you go, about 90 degrees there. Perfect. And then what he's going to be doing is bearing weight back on this left leg. Okay, and he's stretching this psoas on the left side here. All right. So the psoas is a muscle that starts in the lumbar spine and goes to the front of the hip. So it's opening up the hip. And if you don't feel that stretch, there's 2 things you can do here. You can actually take the foot back about 1 inch. Great, take your foot back about 1 inch there. That was actually 2 inches. You're okay there. Okay, great. And then you want to put your body into extension. So then you really feel that psoas muscle opening up there. So that's your psoas stretch. Perfect. Great. The next exercise is the lumbar extension exercise, and what Dr. Eric wants to do here is he wants to put his hands on his knees, and then he wants to extend his stomach out, extend it out there, Dr. Eric, and put his lumbar spine into extension. And of course, the normal lumbar arch is 38 degrees, and you can see how beautifully that's putting his spine into extension. Excellent exercise, and you're going to hold that for 3 to 5 seconds. The next exercise is called the seated scoliosis exercises for both the middle back and the lower back. So Dr. Eric, what you want to do is you want to put your elastic band, you want to place that right on the bottom of the chair, and then Dr. Eric's going to hold on that with his right hand, and he's going to strap that over his shoulder, kind of like you would a purse. And on your card, on your prescription card, your doctor's going to mark where you want to bend. You can actually bend in the lumbar spine here or in the thoracic spine, in the middle back here. And so what I'm going to have Dr. Eric do first is let's do the middle back bend. So if the strap is on the right side, you're going to bend over towards the left side. So Dr. Eric, go ahead and bend from the middle back there. And you can see, go ahead and accentuate a little bit more there, Dr. Eric. There you go, good, excellent. So he's bending his thorax or his middle back towards the left side there. Okay, now we're going to change our fulcrum point. We're going to go down here to the lumbar spine. So go ahead and bend from the lower lumbar spine there. Excellent, good. You can see he's bending from the lower lumbar spine there. Great, good job.
So the next exercise we have is called the quadratus lumborum exercise. So Dr. Eric, I'm going to go ahead and have you lie on your back there. We're going to use the spinal aids. So we're going to place one underneath Dr. Eric's neck here, like this, the cervical spine, and then underneath the lumbar spine, like that. That's great. His left shoulder is against the wall, and his left leg is against the wall. And what he's going to do here, he's going to push his left leg against the wall for 3 to 5 seconds. So Dr. Eric, go ahead and do that. And that's called the quadratus lumborum exercise. What that's going to help do is stabilize the lower back muscles here. Next, we have the L5 spondylo exercise. We're going to use the sleep aids again here. So Dr. Eric, we're going to place this underneath your neck. Go ahead and relax back there. Lumbar spinal mode underneath the lumbar spine there. Next, we're going to take the sacrum wedge out of the spinal care kit, place it underneath the sacrum. To do that, place the wedge here, about right even with the buttock area there. And so what Dr. Eric's going to do here, he's going to take his knees, bring them up to his chest and hold it. And Dr. Eric, do a couple repetitions there. And what this is going to do, it's going to strengthen that lower back to help hold that spondylolisthesis in the proper position. Now there's a second part to the exercise. So Dr. Eric, let's do part 2. This is called the child pose exercise. So Dr. Eric, what he's going to do here, he is going to drop his head, arms forward, and kind of rock his rear end there toward the back of his heels there. And that's going to stretch this entire area right here. So that's part 2 of the spondylo exercise. Next is the leg extension exercise. Using the spinal molds again here. Excellent. We're going to take the head weight that was in the home care kit, loop it over the foot here. Now, if this weight is initially too heavy, we can actually take the weight out, but we're going to start with the initial weight. What we're going to have Dr. Eric do is lift the left leg up and extend it outward. Go ahead and do a couple reps there, Dr. Eric. Up and outward. And Dr. Eric will tell you that he feels that in the quad, the hip, and the lower back. And so those are the areas that will be strengthened when we do this exercise. This is the leg extension exercise.
All right, next one we're going to show you is your cervical flexion exercise. This is for forward head posture. Again, that posture looks like this. It is caused by sitting in front of computers, text messaging, all the things we do on a daily basis. So this exercise is great for virtually anybody. What we're going to do is Dr. Eric's going to come over here and he's going to lay face down. We're going to take our large sleep aid, which is the larger diameter one here. We're going to place it right under the forehead. And when you set this up, you want to make sure that your head's in the proper position. Looking at Dr. Eric's chin, we want to be able to see that his chin is perpendicular to the surface he's on. We don't want to see his chin tucked in under his body at all. We just want him to exert force straight down into the sleep aid. So go ahead and do that, Dr. Eric. Push straight down. Great. For about 3 seconds and come up. One more time. Straight down into the sleep aid and come up. Perfect. Go ahead and come on up for me, Dr. Eric. I'm going to have you turn around and just face the camera. What I'm going to show him is when this is here, he's trying to just push straight this way, and that's strengthening up these muscles right here. Is that where you felt it, Dr. Eric? You shouldn't feel it in your chest or under your chin at all. That means you're pulling down instead of pushing forward. So that's how we do this particular exercise. Great, guys. Now I'm going to show you how to place these sleep aids. Your spinal molds are what are going to help you to restore those proper curvatures in your spine. Remember that you have three curvatures in your spine. You have your neck curvature, which should be 43 degrees, your mid-back curvature, and your low back curvature, specifically 38 degrees. So a great way of remembering these is they average about 45-degree angles, and when those are in their proper place, your spine is bearing weight properly and resists degeneration and decay much better. Hi guys, we're going to show you how to use your foam molds that come in your spinal corrective kit. So your foam molds are for you to lay on at night. They're actually sleep aids or sleeping molds, but you may not be able to make it through the entire night on them initially. So the idea is that you start progressively working forward on those. That's why they're referred to as progressive foam molds. You have two different sets. You have a medium and you have a firm. We're going to start off on the medium and progress towards the firm. You also have a set of slip covers that go over these so that you can take them off and wash them in case you get something on them. Secondly, we have these hip wedges, the pelvic wedges, and we're going to show you how to use these actually in a couple different ways. So when we put these sleep aids in place or these progressive molds in place, we go in the neck and the low back curve. The three curves of the spine, remember, average 45 degrees, specifically 43 in the neck and 38 in the low back. And when those curves are in the proper position, weight is distributed equally amongst our spine, and our spine does not degenerate anywhere near as rapidly. So what we're going to have Dr. Eric do is he's going to just lay right here on his back. And we're going to start with the foam rolls. So the large one's going to go under the neck curvature. We're going to have him lift up his head, and we're going to slide this down. So what we want is to have this just touching up against the shoulders, but not under the shoulders. So I should be able to put my fingertips in between his shoulders and the sleep aid, and we should not see his head coming up off the table into forward head posture. We want his head rocked back, chin parallel or slightly above, and we want to actually see that curvature in the neck. The second placement is we're going to use a smaller foam roll. Unless your doctor has given you a different size, the large always goes up top and the small on the bottom. However, if your specific needs are different, you may have a different set of foam rolls. I'm going to have him put the pressure on his heels, driving his hips off the table. We're going to slide this foam roll right underneath here and drop it back down. We want this foam roll in the small of his back. You don't want to feel it under your hip bones, and you don't want to feel it up in your thoracic spine. You want to feel it right in the small of your back, and we should be able to see that placement right there, just kind of above the belt line. So if you do not have a hip imbalance, these are your sleep aids, and you're going to stay on just like this. The idea is this is your pillow during your corrective rehab phase. Down the road, as your spine's corrected, you may be able to switch to something else, but this is what we're going to use to rehabilitate those curvatures. The second part of this is if you have a hip imbalance, we're going to use these pelvic wedges. Your doctor has marked on your card how he wants you to place these. In Dr. Eric's case, we're going to do it as if he had a posterior hip on his left side. So what he's going to do is go ahead and lift your hip over here, and we're going to take this wedge going on a diagonal right underneath his hip. We're going to have him lay that hip on it, and then we're going to come up. We can show what that looks like. It's on a diagonal going right underneath the hip, so the hip's elevated off the table. Go ahead and lift up one more time, Dr. Eric, and it slides right underneath there. And it may have to butt up against the foam roll, which is right there. Then we're going to take the other wedge on the opposite side. We're actually going to come at it. If this one's coming in this direction, this one's going to come in right at it, pointing right at it, and we're going to put this underneath the gluteal area, just like that. You'll actually feel this, the bone, that if you were to push your fingers right up into your glutes, you feel that bone that you sit on in there. That's what this is under, and this is under the other side. The hips move like this in what's called counter-nutation, and so when we have a hip imbalance, one hip's rotated forward and one backward. So what we're doing is we're putting a wedge underneath the top part, rotating this hip forward, and likewise putting a wedge underneath the bottom part, rotating this part backward, bringing those hips into balance. Now imagine as you're sleeping like this, what happens is the ligaments relax, allowing the spine to go back into a neutral position, and when you wake up in the morning, each day we're starting to correct more and more of those imbalances, and then we're going to use exercises to strengthen your spine so that we can fully rehabilitate those imbalances. Those are